Everyone, my name is Dr. Simone Atkinson with Get to the Point Nursing Notes, and today we are going to be talking about increased intracranial pressure. As nursing students, understanding this condition is vital as it often requires immediate attention and can have very serious consequences if it is not managed properly. So increased intracranial pressure refers to the pressure that's exerted by brain tissue, cerebrospinal fluid, and blood that's within the cranial vault. And when increased intracranial pressure remains elevated for a prolonged period exceeding 15 millimeters of mercury in the lateral ventricles, it can lead to significant issues. But what's really intriguing is our body can handle these transient increases in intracranial pressure, such as those caused by, say, coughing, sneezing, straining, or bending forward, and it wouldn't cause significant harm. However, a very prolonged increase in intracranial pressure can compromise cerebral blood flow, leading to tissue ischemia and potentially life-threatening consequences. So a critical concept related to increased intracranial pressure is Cushing's triad. And this response involves three classic signs, including an increase in systolic blood pressure without change in the diastolic blood pressure, a widening pulse pressure, and reflex bradycardia from stimulation of the carotid bodies. Cushing's triad often indicates that the brain is under increased pressure, and it serves as an important warning sign for healthcare providers to take action promptly. So to gain a comprehensive understanding, let's talk about cerebral edema and hydrocephalus. Cerebral edema refers to the increase in the brain tissue volume due to the various factors like capillary permeability, changes in the cell membrane integrity, or an increase in interstitial fluids. So the severity of the edema is often going to be proportional to the size of the brain injury, so it's really crucial to monitor it very closely. On the other hand, hydrocephalus involves the accumulation of cerebrospinal fluid within the ventricular system. And there are two types of hydrocephalus: non-communicating, where drainage from the ventricular system is impaired in situations such as a tumor, or communicating. And this is where blood blocks cerebrospinal fluid absorption. And this happens in cases such as subarachnoid hemorrhage. Now, recognizing the type of hydrocephalus will help in formulating appropriate treatment strategies. So assessing patients for increased intracranial pressure is a fundamental skill, and early signs include deteriorating level of consciousness, blurred vision, decreased visual acuity, and diplopia, which is double vision. And this is due to pressures on the visual pathways. Headache, papilledema, which is swelling of the optic disc, hyperthermia, and vomiting are some other potential manifestations to look out for. However, it's crucial to remember that late signs such as abnormal posturing, weakness, or hemiplegia, which is paralysis on one side, seizures, and a positive Babinski reflex may indicate more advanced stages of increased intracranial pressure. In terms of diagnostic tests needed, we often rely on the CAT scan or the MRI in order to assess the brain's condition. A lumbar puncture is usually avoided in these cases, however, because suspected increased intracranial pressure, if you do a lumbar puncture, there's a risk of brain herniation that's caused by the sudden release of the pressure. Therapeutic management of increased intracranial pressure is a medical emergency, and it requires us to have very swift action. And our primary goal is to restore the normal ICP or normal intracranial pressure levels through medications or surgical interventions, as well as cerebrospinal fluid drainage. So to monitor intracranial pressure and drain cerebrospinal fluid, a drainage catheter is inserted via ventriculostomy into the lateral ventricle. Now, frequent neurological assessments are crucial at this time, involving monitoring the level of consciousness, behavior, motor and sensory function of the patient, pupil size, as well as the response of the pupil, and also vital signs and temperature. Maintaining optimal conditions is a key aspect of managing increased intracranial pressure. So ensuring a clear airway is essential. And we often elevate the head of the bed by 30 degrees or as prescribed by the physician to facilitate venous drainage. Neutral posturing of the head and the neck also helps to reduce pressure on the brain. And furthermore, we need to be mindful of bladder distension and bowel constipation. I want to assist the patient to prevent the Valsalva maneuver because all of these can raise intracranial pressure. So properly planning nursing care, creating a calm, low stimulation environment, and avoiding prolonged activity can also aid in managing intracranial pressure effectively. Medication therapy plays a crucial role in managing increased intracranial pressure, and we often use osmotic diuretics like mannitol and loop diuretics such as furosemide, because these medications draw water from edematous brain tissues into the vascular system and reduce the pressure. Additionally, corticosteroids may be beneficial, particularly in cases involving tumors. Educating our patients and their families is vital. So for those at risk of increased intracranial pressure, we want to advise them to avoid activities that mimic the Valsalva maneuver, such as coughing, blowing their nose, or straining during bowel movements, because these can be beneficial to prevent increased intracranial pressure. Encouraging that neutral head and neck alignment can also help reduce pressure, and educating our family members to create a calm and a supportive environment for the patient is essential in facilitating recovery. To wrap things up, understanding increased intracranial pressure is critical for all aspiring nurses, and being vigilant about the signs, conducting thorough assessments, and implementing appropriate interventions can significantly impact patient outcomes. So if you found this information helpful, please give the video a thumbs up and subscribe to the channel, and we'll see you in the next video.